I get a ton of messages and comments all the time about rib removals. Do we do them? And my answer is no. Should you get a rib removal done? My answer so far is no. Rib removal means something very specific, and I'm going to jump into this. Rib removal is where we actually make an incision, remove a whole rib, or at least a section of the rib, in order to change your body shape and contour. Now, there are medical reasons that we may need to do this. They're very few and far between, but they do exist. From a purely cosmetic elective standpoint, rib removals, I sort of fall on the no side on this. And why? Because we've got lungs, we've got hearts, we've got very important structures underneath the ribs that absolutely can be damaged when we're trying to remove that rib. And I just don't think the risk versus reward there pays off. Now, something else that's taking place is what we call rib reshaping, where actually a little incision gets made above the rib. They use a special device that helps it just break the bone but not injure the surrounding tissue. And then with those rib fractures or those rib breaks, we can actually push the ribs in. And we call that rib reshaping. Some people call that rib remodeling. And I've answered maybe on that. Why maybe? Well, because it's still a pretty brand new procedure. Quite honestly, it's only been going on in the US for about the past year and a half to 2 years. Most people that have done a number of cases are still probably less than 100 cases. So we're still collecting data based on the safety of this. And so for me, rib reshaping, remodeling is a maybe. It's got some really concerning risks. You could still damage the lungs. You could still injure basically sort of the underlying structures below the ribs. So it's a maybe for me. Rib remodeling or rib removal, hardcore, no.